it's an issue everywhere, but we're seeing it. It's going to be amplified in any places like regional centers and rural centers.
You might not be getting the level of care you want or need if you go to your local hospital, and it doesn't matter if it's rural or urban. That's what some doctors are saying, arguing staffing issues are everywhere.
Across the entire province, we're really struggling with staffing levels. We're struggling with staffing levels for skilled nurses, respiratory therapists, paramedics, and doctors.
Dr. Paul Parks explains those staffing issues have been intensified over the past 2 years with the pandemic, and that means a lot of hospitals are desperately understaffed now, and they just can't give you the level of care they need to.
In the emergency departments in Red Deer, for example, patients are still going there needing surgeries, needing, emergency cardiac care, and the emerge physicians are doing their best, but it's extremely suboptimal and difficult because of a lack of those human resources.
In a statement to City News, Alberta Health Services says it's experiencing significant healthcare system pressures, explaining both emergency rooms and EMS are seeing high volumes of seriously ill patients and the impact of COVID-19. The department reassures Albertans they'll receive the care they need and encourage them to consider other levels of care if it isn't an emergency. AHS also says this issue is happening across Canada and it isn't limited to just Alberta. In Edmonton, Saif Kaisar, City News.